Hey guys, how you doing? How you doing? Good, good, good. Okay, you can hear me great. Hello, 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 hello. You guys can hear me a little bit? A little bit. Hello, 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 hello. Hi guys. Hello, hello. Great, great, great. Okay. All right. Hey guys. So this is Laqueen. I just want to double check to see if you guys can hear me. Okay. Let me see. It is 9:45 here. All right. And let me check to see if, hi guys, it's 9:45 here on Saturday night. It is August the 15th, and I'm getting ready for a lot of upcoming events, as you guys know. So bear with me. Bear with me. I just want to make sure. Oh, here's a mess. I just want to make sure. Bear with me. I just want to make sure. Great. That is. Oh, here's a mess. I just want to make sure. Bear with me. I just want to make sure. Great. That is. Oh, here's a mess. I just want to make sure you're with me. I just want to make sure. Great. That is. Oh, here's a mess. Okay, great, 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 great. I just want to make sure you're with me. I just want to make sure. Great. That is. Oh, here's a mess. Okay, great, great, great. Okay, good, good. Okay, great. So my volume is working now. And I pretty much am just going to go ahead and touch bases with everybody. I have one watcher. So I just want to say good evening. Hi, this is LaQueen. Happy Saturday night. I should be out and about, walking around town, asking people how they're doing. I should be making more money than I am, but I'm not. So pretty much, I just want to go ahead and get started. I do have a lot more things to do as well. So if it's just pretty much people will test you what you already know. It's just general life. I'm going to go ahead and get started. I will be in Wisconsin in the morning as well. So pretty much I want to go ahead and let you guys know what it is I do. My name's LaQueen. I have a business. I do first aid services, adult and pediatric services, as well as I do public safety, like general public safety issues, whether it be fire issues, um, um, trash, clean up trash in the community, traffic control, pretty much general traffic, a major issue with traffic control, as well as public safety measures. Sometimes I do deal with pre like preventing explosions, something like that, usually. So I've had a couple of issues like that have happened in the past in the communities that I've been a part of, but I have worked with preventing explosions, as well as having to come upon a scene after an accident, after there has been an explosion in my community, and pretty much getting the help and the resources that my community needed in order to build back up again. So I have had work with explosions, as well as fire prevention, as well as government buildings, government assistance. I am cleared, a military clearance as well. So bear with me, guys. I'm going to go ahead and pretty much talk about why I applied. I'm certified through the Center for Medicare and Medicaid Services. I'm certified to work with. I'm a counselor. I do mental health counseling, as well as I'm a contractor, government contractor, and I do emergency medicine, and I do preventive medicine as well. So pretty much preventive medicine, first aid, pediatric medicine, adult medicine, pretty much preventive care. A lot of, it's kind of like tactical, like military combat medicine, but it's also, I've been working a whole bunch of protests this summer, as well as here in Boston and New York and in Minneapolis, Minnesota, for the National Mothers March. So it is, I'm just going to go ahead and, pretty much basically tell you guys, explain to you the nature of why I created this business. So pretty much I created Battle First Aid Responder Services in order to help out people and to be available for the community, as well as to be available for other resources in my neighborhood, as well as every single place I've been to. There have been scenes, accidents that I either have been around in the vicinity, or that have affected me, or those close, the previous residents that I have, organizations that have been involved in. So I want to make this into a purpose. That is why there is um, a purpose to everything that I do. So pretty much there's a purpose to everything I do, and that's why I really wanted to be out here and try to get out there and provide services to the community as well. So um, so pretty much I do a lot of preventive services I've been involved in: first aid, narcon opioid overdose, as well as epilepsies. I did a lot of epilepsies. I just did a 10-20 hour course with the World Health Organization on COVID recovery. So I'm very experienced in COVID-19, as well as pretty much right now I'm involved with a clinic, a hospital, to try to get pretty much connected with a supervising physician, as well as connected with the resources I can get out there and be able to let people know things that I have done, as well as to start the billing process. So I really do overlook these videos. And sometimes I do, sometimes I don't. It kind of makes me a little bit happy to actually overlook these videos and just think to myself, yeah, I'm doing a good job having this YouTube channel, as well as being on Facebook and LinkedIn and previous other social media channels like that. But the election season is soon coming upon us. And right now, COVID-19 is a really huge issue, especially with the DNC starting on Monday in Milwaukee, and also the RNC in Charlotte. So there's also an issue with not any participation, physical participation, where it's more online, virtual. They're calling it virtual online. And that is also an issue with population control, because you need that delegate count. You need that physical, present delegate count in order to win the presidency. The United States presidency, you need that delegate count. You need that delegate. That's the only way you can win the presidency of the United States, is either through the super delegate count, or the delegates turn 360 through whatever total amount it is. It turns into your delegates, and then you have percentage of those delegates, which are super delegates, which turn into that vote that you need, as well as either the super delegate vote, or it's either the popular vote that you need in order to win the United States presidency term. Okay, so there's a lot of other issues as well, but pretty much I'm trying to become more involved in my community provided services. So pretty much I'm going ahead and read over what the definition of emergency medicine is, because I want to let people know now, in order to practice medicine, you have to be, of course, you have to be stably mind. Okay, so in order to, you have to be physically and emotionally able. So in order to practice medicine, you have to be physically present, as well as emotionally and mentally available for you and your patients. Most cases where a lot of first responders, especially right now going on with COVID, a lot of these medical people, these first responders can be anybody. They can be nurses, they can be doctors, they can be police people, they can be EMT, they can be firefighters, as well as people that respond to any kind of emergency situation. It could be a daycare worker, and they have to respond to a child throwing up, or a child becoming unconscious, or it could be a teacher down the street. Everybody knows her in her neighborhood, and if they need any kind of help, they call on the teacher to be present, and right automatically she is available. So she can go to the house next door and just help somebody with a baby or pregnancy, something like that, or if somebody needs help with a dialysis treatment. Most further issues like that. So, which is also something I need to work on. So, of course, there are a lot more issues involved with being a first responder. So, yes, I am a certified first responder. Yes, I am. So, first responder. So there are a lot more other issues I need to work on, as well as the clinical side. I need to develop more clinical skills. I do have the liberal arts background, so it applies to pretty much everything general in medicine: biology, chemistry, anatomy, physiology, as well as the philosophy behind medicine. So pretty much working in medicine, you have to deal a lot with ethics. And ethics is pretty much understanding what you do, and what your reason behind your goal in medicine. So pretty much I have a whole bunch of books. I have John Hopkins. I also have the good books all the time. I have so many guys that to be able to help me figure out what it is, the different courses, everything that's involved in medicine. So pretty much I'm going to have to, as it is August, it's mid-August, the different systems of the body. You have right here, you have the immune system. You have the bones, the muscles, the circulatory system, the digestive, the endocrine, and immune, and the nervous system, and your major senses organs: your eyes, your nose, your mouth, your ears, and your skin. So pretty much that is what I'm learning every single day. I have books all over my office. I love books. Literally, I love books. Literally, I love books. I love books. I love books. So books are my heart. Literally, I get high off. I love books. I literally, I'm high. It's like a high for me because I've been in books all my life since I was God, second grade. I've loved books. I've loved Babysitter's Club, Nancy Drew, um, uh, um, Anne of Green Gables. I just love books. Little Women, Anna Karenina. I just love books. So that's a high for me. But pretty much that's why being involved with medicine. I do this on the side as well as my YouTube, Facebook, Twitter, LinkedIn, my social media presence, and being involved in the community. So being involved, especially with a lot of the Black Lives Matter protests, being involved in my community, helping with very, very fundamental, major accidents, disasters, small disasters in my neighborhood. So being available as a responder to emergency disasters in my neighborhood. I don't know if they were terroristic or not, but some things like that, which can be a little bit out of control. So pretty much I'm just letting people know what it is that I do and how I'm available for services for you or for your agency or for your convention or for your party or for everything that you have pretty much going on. I'm here in my office here in downtown Boston. There's usually people all around me all the time, as well as I'm in a community. Police know me, feds know me, the city knows me, the mayor knows my face all the time, and the governor. So Karen Polito, Governor Baker, and then Marty Wash. They pretty much know me on a general face-to-face basis, but usually have to set up an appointment or email with them to have a front of a conversation, a meeting. So pretty much as general what I do, I'm available for services. I'm also available for security measures. I do have a military background, so I don't know my clearance level, but I can also get that for you guys as well. Okay. Yes, I need to get that too as well. So I'm getting ready for Milwaukee in a couple of hours. I'll be in Milwaukee. It is 10 o'clock here on Saturday night. I really want to make this as clear as possible what it is. So I can present myself as a great candidate for services. Now, I will be starting a job working at a institution in a couple of weeks here in Boston, as well as being involved in more COVID research and also being published in an academic journal, being published in an academic medical as well as an academic legal journal to let people know that I'm professional and that if I see the same symptoms and the same instances of this happening, especially in my own community, then yeah, it is happening for everybody else as well. It's not just happening for me, but it's happening for a lot more other people involved. So yeah, there are a lot more things I need to take care of as well as do and get ready for it's convention season. So I should have already been in Milwaukee by now. Literally, I should have already been in Milwaukee or whatever. But I'm pretty much just general trying to be involved and get as many credentials as I can. I mean, physician's not even it. I mean, I need to get um, security clearance. I need to get my construction certification, my OSHA, as well as a whole bunch of other certifications. Let people know that I'm credentialed and qualified. And then as soon as I get more and more of the certifications, as well as keep reading up, keep wondering what's going on in the news, as well as what's going on medically and internationally here, domestically in the States, as well as what's going on overseas, then I can use that to travel more and to be more involved in internationally with the United Nations, with the World Health Organization, with um, Peace Corps, Doctors Without Borders, things like that, and be more involved specifically as well as socially. Okay. So pretty much I'm going to go ahead and get straight to it. What emergency medicine does is it includes the initial evaluation, diagnosis, mistreatment, and coordination of care among multiple providers and disposition of any patient regarding expeditious medical, surgical, or psychiatric care. So I'm going to go ahead and leave it at that. I'm going to end this live feed. Now I'm going to let you guys know right quickly who I am. I'm going to get straight. I'm going to go ahead and do another video on detailing what is emergency medicine. And then I'm going to go ahead and get right briefly to this short video. As you guys know, I'm on Facebook, Twitter, Instagram, LinkedIn, and I also have a website on Google Business. So I will go ahead and try to get updated with that. I have a whole bunch of clothes I need to pack, as well as some medical supplies to get ready for Milwaukee in the morning with the city and with the local hospitals that are there. Let them know that I'm involved and be a part of what's going on right now. As well as I should have got Yeah, I should have got a a doctor's jacket, a clinical jacket. So anyway, there's a lot of other events going on, and I do plan to be a part of it. I am available. I'm single right now. I am it is dating season, and everybody pretty much already knows my type. So I don't see why there would be a difference to Boston. Maybe I'm going to treat in Boston, but pretty much everybody in general already knows. Even in Chicago, even in Dallas, even in New York with the NYPD, and as well, everybody pretty much knows my type. So I don't know why I'm getting less than that right now, which is really kind of sad, but I am dating. I'm available. Looking for somebody who's professional as well as who's older and more mature and a very athletic person because I like to be involved. I like to walk a lot. I like to be physically involved as well as somebody that's warm and tenderhearted. So I have a very demanding career as well as I'm involved pretty much every single where. I love to be involved in my community. I love to help out people and I love to travel when I do get the opportunity. So I'm also looking for somebody else that can help me out, contribute to that, and be emotionally part of my life. And I will be emotionally part of their life as well. We can be both partners. So, and on an equal 50-50%. So pretty much I already talked about my last video about you just want somebody more than just a check. You're looking for somebody more than just a check. You're looking actually for somebody to help lift you up and help move you up, level up into that person. So yes, I am looking for a little bit more than that. And I'm looking to be more involved politically and, hopefully better my reputation, whatever is left of it. So anyway, work with me, guys. I'm going ahead. As you know, I just graduated from Purdue University with honors, which I talked about my last video feed. I have as 2 degrees in Spanish. I have humanities, liberal arts degree in Spanish from Purdue University with honors, and I have a associate's degree in liberal arts and a concentration in Spanish from here at Washington College, as well as a certified medical assistant front and back office a diploma from Northwest Educational Center, which is now a small community school in Houston, in Northwest Houston on Antoine Boulevard. So that is accredited by the city of Houston and by the state of Texas. Northwest Education Institute is an accredited institution. It won't be accepted everywhere, but is accepted by Harris County Community College. So it's accepted in the state of Texas. Okay, and then I have over 15 different certifications. I have a certification in narcotic opioid assistance. I have a certification in seizures, which I'm trying to get more classes in seizure assistance with the National Epilepsy Foundation. I have a couple certifications in COVID-19 research with the World Health Organization, as well as with different classes I've taken online for COVID, as well as I have a certification in adult mental health aid services for suicide prevention, as well as basic counseling. And then I also have pediatric mental health aid services. Now, my professor was the teacher of the class was Dr. Carl Shallowhorn. He said to us at attended the class, it was an 8-hour class. He said, do not use this mental health certification as a credential for counseling, which is not. It is not a substitute for going to school and getting your master's degree in counseling. What it is just a basic preventive measure like peer support. You let people know that you're available for suicide prevention. Are you available to help people out in public schools? Or you just are available to help people out in general if they're going through any kind of suicide crisis with young kids or adults. You just be able to help with mental health and understand what a lot of young people as well as older adults are going through with mental health issues. So it's pretty much a general over course. Now you can get certified through the National Mental Health Institute, NAMI, as mental health counselor, which I'm trying to get done right now through peer support. Another peer support certification through the state of Massachusetts, which I'm also trying to get, as well as I'm trying to get a peer support certification, as well as a community health worker certification, and as well as my next certification out of that is I'm trying to get my HIV STD screening certification. So, which in New York State has the best classes in education for HIV STD training. So they have over about like 1,500 classes in HIV STD, any kind of you want to be involved with the gay and lesbian community, transgender community. They have great classes on that in New York State, as well as pretty much here in Boston, but New York, definitely, and San Francisco and Chicago. But New York has one of the best health systems. Pretty much, it has a lot of community involvement with young people. There are a lot of health services as well as mental health services for young people. And New York State has a great VA system. One of the best VA systems I've seen has been in New York State. It just depends on where you go because you get a little bit different service everywhere, as well as here in Boston. Boston, Massachusetts has great mental health services, but it's easy getting in, but it's hard getting out. So as long as you're in the system, you should be good to go, which I'm great. I was able to get services here in Boston, which is great. All right, so pretty much I have over 50 other additional 10 certifications to help out. And mainly I'm going to put all those credentials together and as well as continue more clinical classes with medicine. The IV certification, which you also can get as a medical assistant. The main difference between a medical assistant and an LPN nurse. An LPN registered nurse is authorized to do a little bit more than a medical assistant. Now, with a medical assistant and a CNA, a CNA is just uh, basic aftercare. The medical assistants do more preventive care. They do injections. They do pap smears. We do pap smears. We do injections. We do flu shots. We do immunizations. And the CNAs can do the same thing, but they also do have that limited scope of practice. So actually, if a CNA is practicing, if a CNA is doing injections without any kind of overhead, they can legally be in trouble by the law that they're practicing in. Now, with CNAs, they have to be approved by this every single state board that they practice, become a CNA and a certified nurse aide. So they have to apply for that certification through every single state that they work in, as well as through an LPN, as well as through an RN or an MD. They have to apply for state certification, state boards. Now, a medical assistant is national certification. So once you are a certified or a registered medical assistant, you can be employed anywhere in the United States, and you still do not have to go through a state board to be qualified as a medical assistant. What it is, you have to get your approval from your supervisor who you're going through in order to become employed at that hospital or the clinic or the nursing home or wherever you're trying to work. Now, that's pretty much general. Medical assistants could be specialized in whatever they want to do, just like CNAs or RNs or whatever. But pretty much what it comes down to is that medical assistants are more clinical and CNAs are more home care. And LPNs and medical assistant. An LPN is about on the same level as a medical assistant, but LPNs have a little bit more overhead. They still have to be registered in every single state that they reside in, but with the CMA, a certified medical assistant, they still have to be under the supervision of a registered nurse or a doctor, the same as an LPN. But the CMA, the medical assistant, does not have to do the registered boards as well as do pretty much they're not authorized to dispense any kind of medication unless over the approval of a provider, which has to be a physician or a nurse practitioner. Okay. And they have pretty much the same functions, same duties as a licensed practical nurse, but a medical assistant and a licensed practical nurse, the main difference is the state boards as well as pretty much general sedation, IV, all the IV stuff, which a certified medical assistant can be certified to do if they take additional classes for IV training. Okay, IV insertion and all that stuff, which a medical assistant can do that as well. And the state boards and approval, the NCLEX and all that stuff. Now, with an LPN and an RN, a licensed practical nurse and a registered nurse, an LPN it has a little bit less overhead than a registered nurse, but a registered nurse has that proper authorization and authority to handle medications, and a registered nurse has the authority to handle pre-authorizations for any kind of surgical procedure. So you would need supervision. You would need approval from a registered nurse in order to get any kind of clearance for surgery or for a clearance for to see a specialist doctor. If you see your PCP, see your specialist doctor, you would need a registered nurse instead of a licensed practical nurse or a licensed vocational nurse. Now, also, RNs, they do administer more specialized medication, as well as they do more drug testing. They also do, pretty much the same thing as LPNs. They do more community care. Anything more specialized that a clinic needs, they really give it to a registered nurse because a registered nurse is legally able to handle more insurance. They have a little bit more liability, less liability than an LPN does. Okay. All right. Pretty much an LPN is the same thing, home care. But LPNs are also authorized to work in clinics as well as hospitals. But a lot of LPNs work in nursing homes and home health care facilities that pay them just as much if they could be. Sometimes they're paid a little bit more to work in nursing homes than they are in hospitals. It really just depends on what hospital and what the pay rate and what the hours they're looking for and how comfortable they are working in a hospital setting versus a home healthcare setting. Sometimes home nursing homes, home care facilities pay their LPNs up to $50 an hour, depending on what city you're in. If you're in Los Angeles, Chicago, New York, or Houston, they may be able to pay LPNs up to $50 an hour. It just depends on the need, as well as registered nurses. Registered nurses can make up to $75, $100 an hour. It just depends again on the need, as well as the availability of theirs. So they can get paid more. They can make it just as much as a doctor, registered nurse, if they are well qualified and if they meet whatever the demands that the department or the hospital is looking for. Now, a a registered nurse and a MD, a registered nurse has to go through um, her boards, her NCLEX, her nursing board. She has to go to school to become a registered nurse. So you could go to school a 1-year class if you get your undergrad, and you could take a 1 or 2 year course to get certified as a registered nurse, which a lot of schools do. Or you get your associate's degree in nursing, which you become out of a registered nurse out of that, or you could take a private school and you can still get registered nursing, your certification out of that. It really just depends, or which would be what they call grandfather nursing, which a lot of hospitals also do grandfather nursing, which older women, older mothers have worked in a hospital setting for over 10, 15, 20 years. And pretty much since they've been working in that hospital for so long, okay, that hospital, therefore, they move up the ladder in nursing up into that hospital. And so they're grandfathered up the ladder of that nursing credentials. So they usually come in as CNAs, home health care aides. Then they continually get certified, more certified, and then they become a registered nurse. So they're grandfathered into nursing the um, through the registered through the hospital system, so they can get their certification through the hospital system as a registered nurse instead of going to a accredited school, if you get what I'm saying. You can also get your registered nursing through the military as well. The military has great programs for nursing, for medicine, and usually they're really quick, and you get free housing as well as that military training to help you become disciplined, and you get to travel. But also the dangerous aspect, because once you become a contractor or once you join the military, you are dedicating your whole life 100%, even after you serve your time limit. Because once you are a service member of the military, they own you for life. So um, you have to, whether you get discharged honorably or not, you still are liable to the United States government. So you still have to be responsible for your actions, even after you are discharged from the military. So another way to get your registered nursing credentials is through the United States military. Air Force, Navy is great for the nursing corps. Army has a great nursing corps as well. So Navy, Army, and Air Force have great nursing corps, as well as the Marines and the National Guard, Coast Guard as well. Okay, so and then community programs. If you are overseas, or if you have learned how to become a nurse naturally, the natural way, and you're a doula, or you're involved in your community so much through doing so much naturally, you're exposed to it every single day of your life, and then all you have to do pretty much, and especially a lot of countries overseas, they just pretty much they get all the education. They go to practice in a community school, like in Mexico. They have programs. The Mexico, Europe, the country pays for their medical training. They pay the students, and then students go to there, become involved in the community, and then once they graduate from the nursing program, then they have to literally go out into the rural areas, Mexico, uh, Middle East, go to the rural areas and service their country that way. So that's also a way. And then with a medical doctor, a registered medical physician, MD, or a doctor of osteopathy, as well as a physician assistant or a nurse practitioner, you have to go through boards for anything higher than those. And there you have to meet credential clinical hours. Usually with a medical doctor is over 7,000 hours or more. With a nurse practitioner, there's a certain limited amount of hours that you have to serve clinically, and you also have to meet medical ethics as well as graduate from an accredited school, or you could be involved in the military. That's another way to become a medical doctor, as well as, of course, taking your boards, going to school for that, being certified through a group of your own peers that you are medically cleared, physically cleared, drug-free cleared, as well as religiously and ethically sound of a sound mind to practice medicine to serve your community and whatever religion or area that you are involved in. So being a medical doctor, a doctor of osteopathy, a doctor of natural osteopathy, you have to be medically cleared, mentally and ethically bound to your profession. So literally, if you are not practicing medicine at that moment in any particular area of your life, whatever age you are in, but people know that you are a medical doctor and you are involved in an unethical situation, but you are not working, you are not on the clock, and people see that you are in an unethical situation and you are off the clock, or you are in another city on vacation and you are doing something unethical, you can literally be sued and lose your license for life because you represent the medical profession and you are and um, bound to your code of ethics, medical ethics. So you can be sued, you can be disbarred, or pretty much you can be disqualified for continuing your profession. So that's another issue. So whether you're on the clock or you're off the clock in any position that you are in medicine, you are legally and ethically bound to be of a whole sound mind. So pretty much people don't understand that. They think, oh, you're a doctor, you can do anything you want to do. You can sit around, you can have fun. No, you can't do that. You are ethically bound to your profession as well as to the duties of your job. So even something as small as a traffic ticket or a lie, or you're being sued in civil court, you can still lose your license. If you are an MD and you are being sued in a civil matter, they could take away your medical license. So you literally have to abide by medical code of ethics, whatever field you are in or wherever you are in the world. Okay. So there are a lot more things I got to talk about right now. Um, I'm with the state of Massachusetts as a nonprofit. I do first aid, adult and pediatric services for young kids at 6 months old. And then I work with, just basic first aid services. If they got a little spider bite or they got a little wound, they got a little bleeding, I put a Band-Aid on it or I check their temperature. Pretty much basic first aid for kids. As well as I'm available to do immunizations. I don't have the flu shot right now available, but I am available to do immunizations through the clearance of a pharmacy, which CVS or Walgreens is here. I am able to travel as a temporary clinic, as a walking clinic, and be able to administer the immunizations needed under the direction of a medical doctor or a nurse practitioner. So under how it works is if I have a lower license, but I am pursuing a higher license, okay, if I'm working at a CNA or even as a PCT and I'm going to nursing school or I'm a PCT medical assistant or a CNA, and I'm working as an EMT at a fire department. I'm a fire department, but I'm also working as a volunteer firefighter, and I'm also working as a certified EMT or a medical assistant in a hospital. Then literally I could still go practice both jobs, okay, but I still have to be under my own scope of practice, okay. So I just want to keep it at that. I just want to let you guys understand. I'm going to go cut this short because it's 35 minutes and I got to get ready for tomorrow. I'm going to cut this video really short because it's very, very important that I get to what it is I need to do, because a lot of people have it confused. I think somebody has a history, the past history of mental disorder, or they have a history of drug addiction or alcoholism or jail criminal history background, but that should still not limit you from practicing in the medical field. Don't let people discourage you. You still have to be cleared physically as well as continue the drug testing, whatever is needed medically as well as ethically to be a nurse or to be a CNA or to be a doctor. Okay. So you can still have a past background, but you have to be cleared by your profession as well as your overhead, your supervisor, your overhead to practice medicine. So don't let your background stop you from being who you want to be, a nurse or a doctor. Okay. So I'm going to get to this. Okay. I'm going to go ahead and cut this video short. It's 30 minutes into the video. Thank you, YouTube, for letting my volume is working now. Thank you, YouTube. And I'm going to go ahead and next, I'm going to get to what is called my next video, which is called a scope of practice, my scope of practice. Okay, I really want to get into that. So right now I'm 25% into this. I want to get into uh, pretty much about, I'm going to call this 25%. I'm going to call this 50%, my 50% Dr. Laqueen battle video, which is called Scope of Practice. Okay. So I'm going to go ahead and get into this. I will, it's about 35 minutes into my YouTube live. I'm going to get to the next video. Okay. So I'm going to cut this short and guys join me on the next live feed. Okay. Bye.